95 News at 9 is now time for Aging in Style with McLaren. We are here this morning with Dr. Yusuf Bader. Thank you so much for being with us. We always enjoy having you with all the information that you have for us.
Thank you for having me.
You're welcome. February is Heart Month, and today we are talking about a very important issue, aortic valve stenosis, and how the team at McLaren is repairing this condition. Tell us a little bit about, first of all, what that is.
Sure. So aortic valve stenosis is basically a restriction in the aortic valve. The heart has several chambers, and within these chambers there are valves that allow for the forward movement of blood and preventing leakage of blood. So between the main pumping chamber of the heart and the rest of the body, there's a valve that's called the aortic valve. Some people develop a condition where that valve thickens and calcifies over time, and that valve no longer opens well. Okay. And so that causes a backup of pressure on the heart, and people can have symptoms like shortness of breath, chest pain, dizziness, lightheadedness.
That's great to know those symptoms. Now, not everyone wants to have surgery, and you know there are other options out there instead of heart surgery. Tell us about those options.
Yeah, so you know, traditionally open heart surgery was the only way to treat aortic valve stenosis. Okay. More recently, there's a procedure called TAVR, so that stands for Transcatheter Aortic Valve Replacement. And basically what that means is that through catheter approaches, through blood vessels in the groin or in the shoulder, we can actually pass catheters to the heart and implant a fresh valve that way. And with these new procedures, outcomes have been just as good as open heart surgery.
So tell us, doctor, about some of the pros with having this procedure instead of the open heart surgery.
Yeah, so several things. So one, based on data, in certain patients, outcomes are better. So patients live longer and feel better. Data also supports less strokes in patients that have it through a catheter-based approach. And then the time in the hospital is much less. So people are in the hospital for 1 or 2 days after a procedure like that.
Wow. Okay.
Compared to 5 or 6 days with open heart surgery.
Yes. Tell us about McLaren's Structural Heart Clinic. It's a very, very important clinic, and it's right here in mid-Michigan. That's so exciting.
Yeah, so the Structural Heart Clinic, or the Valve Clinic as we call it, is basically, it's something we're very proud of. It's a clinic that we've set up to see patients with valve problems. And so what's unique about this clinic is that these patients see myself, a valve nurse, as well as our open heart surgeon, and collectively as a team we kind of discuss the patient's condition, discuss with the patient, their family members, and try and get all of the necessary testing done in a single day to give them the best solution for their problem, whether that be just medications or open heart surgery or some of these newer procedures that can be done through catheter-based approaches. That's
great. Dr. Bader, now you're here with us and you have so much knowledge, and we are not going to let that knowledge go to waste. So it's February is Heart Health Month. Tell us what else is important that you'd want people to know about this and our heart health.
So, you know, my father's a primary care physician, and one of the things that he always tells me is prevention is better than treatment. So I think just making sure people exercise, eat healthy, and, you know, visiting consistently with the doctor to try and prevent the risk factors for heart problems in the first place, you know, high blood pressure, high cholesterol, and things like that, and to make time to take care of themselves.
I love that. Dr. Bader, thank you again for stopping by.
Thank you very much for having me.
We appreciate it. You're welcome.
Thank you for having me.
You're welcome. If you have any information at home, you want more information about today's topic, just check out the Aging and Style page on our website, WNEM.com.